I'm Dr. Ren Massey, presenter of Competent Care for Transgender and Gender Nonconforming adult clients. What every clinician should know. Helping transgender, gender diverse, and gender questioning people find and express themselves authentically is incredibly rewarding. It can also be extremely complicated. There are two main reasons I provide this training that will have something of value for almost any clinician. First, many clients tell me about having seen clinicians who claim to work with trans or LGBT clients. What these patients often discovered was that well-meaning clinicians didn't really know about trans and gender diversity issues. These professionals couldn't provide guidance about the legal and social issues. I talk for nearly an hour on just medical issues for which mental health clinicians actually share liability when they make these recommendations. These professionals couldn't speak about the research or help develop gender transition plans. So many clients suffered needlessly because of inadequate professional support. Some were delayed in their gender transitions or made poor choices in their processes. Being open-minded is not enough to qualify a clinician to work with a trans and gender diverse population. This community is similar to, but also different from LGBT clients. This community has highly specific needs, which the clinicians must know in order to serve them effectively and therefore ethically. The other main reason I conducted this workshop is that many colleagues have asked me questions or consulted with me about their accidental trans or gender diverse situations. Maybe they're seeing a patient whose child starts discussing gender incongruence, or maybe another relative like a parent or sibling. In some cases, a spouse or partner revealed questions about their gender identity. There are even instances of the colleague's client disclosing their own gender questioning. These colleagues had no solid foundation of knowledge, information, or experience to inform their work with these clients. I packed this workshop with lots of information, case examples, and material based on the standards of care of the World Professional Association for Transgender Health. This is part one in a series of workshops and covers working with adults as well as foundational information, because this material will be necessary for work with all trans and gender diverse patients of any age and will ensure a grasp of the scope of issues for this population. I want there to be more professionals qualified to work with trans and gender diverse patients and their loved ones, rather than practicing outside of their scope of competence. So I offer this program to my colleagues, and I dedicate it to the trans and gender diverse community and their loved ones. I hope you'll find it enjoyable and engaging. Thank you for your interest.